Okay, next in our series of tips from a cancer survivor, reminders for me in case I have to do this again, and maybe will help you, is 5 steps, tasks to accomplish as you prepare for surgery. So as my normal caveat, I'm simply sharing what works for me, what I've used and done in the past. If it's helpful to you, great. Please consult with your doctors and medical support team to make sure that they're in agreement. But this is mostly preparatory stuff. So my number one task is set your attitude and have your feelings. So my number one item in this task is believe in your surgeons. Really believe in them. Believe that they know their stuff, that they know what they're doing, that they're looking out for your best interest. And they want, I think we all know, they want positive outcomes because they reflect on them, but they also want the positive outcome because you're a human being and they want you to succeed. Next, consider your feelings. So if you need a mini pity party, I'll link the video here. I think it's on this side, but whichever side. I did a video a few weeks ago about the value of a pity party. Maybe you need a little mini pity party to deal with your feelings regarding the surgery and its outcome. And kind of linked to that is the ability to grieve or celebrate what's going to happen here. Like all surgeries, there's some grief, I think, but there could also be some celebrations. So as an example here, this surgery that I just had removed my breast implants from 9-10 years ago. And, any surgery is not really a celebration, but one of my breasts was very deeply encapsulated and hurt nearly from the first time that it went in. So for all these years, I've just been dealing with this kind of low-level pain on that encapsulation. And I guess I don't even know if it was low level or just whatever level it was. It was always there. You learn to deal with the pain. This week, despite having just had surgery, I'm like, that doesn't hurt anymore because that's not there. That foreign body isn't in my body. The encapsulation isn't there, causing pain and discomfort. So there's a little bit of celebration for that, right? And I kind of was thinking about that as I was preparing for this surgery. And then I guess the final task in this area of set your attitude and have your feelings is to take some time to accept your post-surgery self. And this is a little bigger task than you would expect. So you're going to have some temporary and permanent physical limitations coming out of any surgery. So temporarily, usually they'll tell you anywhere from 2 to 6 weeks, you're not allowed to lift. You may not be allowed to drive for some period of time. You'll lose some independence. You may have restrictions on what you can eat or drink because they're worried about certain interactions. Every surgery is different. I can't really accommodate them. But you will have some temporary or permanent physical limitations. So like in the case of the breast implant removal, I have a limitation to not really use my upper body for 6 weeks. Does that mean I'm going to feel horrible for 6 weeks? No, but they're worried about, everything settling and so forth and so on. Or another example is I'm not allowed to drive while I have, probably for the first week or so, maybe longer, while I have surgical drains, at least the first week. Nearly everyone cannot drive for the first 24 to 48 hours after surgery because of the anesthesia still in your body. So there's all kinds of restrictions that may be very short or longer, and you just have to learn to accept those and consider how you're going to feel when you have to accept those limitations, particularly if you're a particularly independent person and now you have to depend on people. You may have missing parts. After my first mastectomy, I was missing part of me. Now I'm missing the implants. I don't have as much of a connection to those. Or extra parts, hip or knee replacement, for example. You lost a part and you get a new part that's not really you. These feelings, there's feelings associated with that. Think about them in advance. Don't get wallowed in them, but kind of prepare yourself, your mind, etc., for how you're going to feel and how to live with them. And then I think the most important thing here is living after your surgery. So you're gone through the surgery so you can live. Now live. Don't get mired in Oh, I can't do this anymore. I can't do that. What can you do? And again, looking at the big picture, not in those first few weeks, maybe in a month or 2 months or whatever it is, but the reason to go through the surgery is to live. So make sure that you make it a priority and that you've considered how you're going to live. If, as an example, after my first mastectomy, I was unable to do yoga for an extended period of time because my surgery impacted obviously my chest, but I also had back surgery and there was limitations on what I could do with my muscles and everything. So, that made me have to change the way I wanted to exercise at that time and the way to move my body and strengthen certain parts that I used to use yoga for, right? So all these kinds of things, but you have to remember to live. That's the important part. Okay. Task 2. Pre-op action items. So some of these are, you probably will have pre-op doctor's appointments. You have to go visit the doctor. Some doctors may make you sign some paperwork. They may just establish what the process is going to be, write out scripts for you. They might have directions if it's a surgeon that does this type of surgery regularly. They may have papers or a website with details of what to expect and how to prepare. Those are the kinds of things. It's probably helpful if you bring people with you to your pre-op, if you have support people, loved ones, friends, whomever, so that you get an extra set of ears hearing what the directions are. Pick up any over-the-counter or prescription meds you might need. So if you're having a significant surgery, you might have narcotics you need to pick up. You might have any surgery. Most surgeries nowadays, they might give you antibiotics for some period of time to protect you, prophylactically from infection. There might be over-the-counter prescriptions I recommend. For example, if you're taking narcotics, I think I talked about this last week or the week before. If you're taking narcotics or certain nausea medications that may slow down your digestive tract, you may need a Colace or a Miralax or some medication to help you go to the bathroom. Or you may need some medication that slows things down if you're going too fast. You might have a reaction to the antibiotics. You might need a probiotic to counteract the impact on your GI tract from the antibiotic. Like, there's all kinds of over-the-counter things. You might need Advil. You might need Tylenol PM. For me, I regularly need Benadryl because I have allergic reactions to adhesive. There's all kinds of things. So ahead of time, before your surgery, if possible, prepare by picking up those over-the-counter meds that you might need and your prescription meds. Consider your day before prep. And by that, you're going to get these directions from your surgeon, but some examples might be they will want you to shower with a special soap, hibiclens, Lever 2000. I'm trying to think of anything else. So they might give you directions, very specific directions for how to wash your body from top to bottom. Leave the soap on for this long, then rinse it, then do this, then do that. And do that the night before, do that the morning of, those kinds of things. They'll give you very specific directions. So the reason I mention this is a lot of people don't have hibiclens or Lever 2000 or whatever the soap of du jour is for your doctor. So you might need to pick that up as well. So that's another thing you can prepare in advance. That's not something you have to rush out and get the day before, right? Another example might be super absorbent pads. Like if it's some kind of female surgery, you might need something like that. Sterile gauze. Oftentimes the surgery place, the hospital, wherever, they might give you what you need post-surgery for a few days or even for the following week until you go to your post-op. But sometimes they just give you a day's worth and you need more. And that's a question to ask your doctor. Do I need any supplies at home to prepare, like some kind of pads or, whatever. So that's another thing. Special equipment, like in the example of a knee replacement or a hip replacement, can I sleep in my bed or do I need to get a hospital bed? Do I need special pillows or wedges because I have to sleep in a certain position or I need to elevate a body part or whatever the thing is, right? So you might need a walker, you might need cane, any things that you might not have at home, a commode, right? So this seems silly, but if your toilet's at 17 or 18 inches and you've just had a knee or hip replacement, you might not be able to bend down past 20 or 21 successfully, right? So a commode can lift that toilet up for you to be able to go to the bathroom independently without somebody helping lift you, for example. And it also has arms. So in addition to being higher, it has arms so you can use your arms and your legs to lift you. Another thing that I think is pretty critical, but most people might skip it, would be an app or a notebook. You can go old school or new school to record. And the things that I would record are symptoms. And as an example there, if you had diarrhea, if you were vomiting, you just feel bad, you have a headache, any of those kinds of symptoms, temperature, blood pressure, your doctor will give you guidance about what they want you to pay attention to. So symptoms, meds, and this is pretty critical, especially when you're not feeling well. And if you're doing your primary caregiving, or the person that's helping you is kind of in and out, if you're taking narcotics, or even just over-the-counter Advil or Tylenol, ibuprofen or acetaminophen, you have to take it at certain intervals for it to be effective, and you don't want to take it too frequently. So noting it down in a notebook or in an app, so you can go, oh, it's hurting, oh no, I have another hour till I can take it, or oh, it's time. Having it written down so don't count on your brain, because your brain is a little wiggly at this point. And then finally, doctor questions. So you will have a post-op appointment, at least one, and at that appointment you might have questions, so recording those questions in advance, thumbs up, so you're prepared. The app I'm using is cancer.net. It lets me do all of those things, but like I said, just paper and pencil does the same thing, pen, whatever. All right, next, third task, prepare your nest. Sorry guys, this is going to be a long one. I have a lot to say apparently. It's fresh in my mind. Okay. So first, for preparing my nest, was catch up or exceed on all my household chores. So things like laundry, dishes, cleaning, those are not things you're going to be doing when you get home from the hospital. So you want to make sure that everything's caught up, you're at level and beyond if you can. Make sure any clothes you need to wear is clean. If you're supporting your family, their clothes is clean, all that kind of stuff. Pre-plan for your post-surgery restrictions. And what I mean by that, as I gave an example, but most surgeries, you're restricted on lifting post-surgery because they don't want you to put any stress or strain on your incisions or the parts of your body that they just fixed or helped. So some examples would be, if there's something in your daily life that weighs a lot, either place it someplace where you no longer have to lift it. Like an example might be for laundry, although you won't be doing laundry right away, is if you have a heavy jug, have it placed right where you're going to use it, so you don't have to open, you don't have to lift it. You can just push a button and the detergent goes in. Or if that's or another alternative would be to spread out your detergent in this example into small little pieces, less than whatever your weight limit is, so you can do that. Remember also, we'll get to it, but you can have support people help you, so it's not all on you. Sleep. So I found this with every surgery I've had. Sleep is usually restricted in some way. They want you to stay on your back. They need you to be elevated this way. They need the body part that just got fixed to be elevated. Like, there's all kinds of things. They need it to be straight. They need it to be bent a little. Like, there's all kinds of restrictions. So obtaining the materials you need to rest comfortably after surgery would be an important task. So pillows, wedges, recliner, if you have a recliner, or obtaining a recliner. I guess I'll just kind of toss out here, at least here in the United States, how do I articulate this? Sorry, just put my thought together. It's not necessary for you to purchase, you can certainly purchase different supplies and things that you need post-surgery, but there are several organizations like visiting nurse groups and often churches or places of worship that collect folks' supplies like this, support things, and then they make them available to you for free. And it's just a matter of contacting them and say, hey, do you have a hospital bed we can use? Do you have a walker? Do you have a commode that can go this high, or whatever the thing is? And often they can help you out for $0 or minimal donation, that kind of thing, but much less than purchasing. So I'm not encouraging you to spend lots of money, but I am encouraging you to have your house prepared for coming home. And then I guess the last thing for preparing your nest is to stock your fridge with, the items, your comfort foods, excuse me, easy snacks, meals that can easily be prepared, etc. Okay, task 4 doesn't apply to everybody, but to many, would be work transition. excuse me, oftentimes surgery is associated with an extended leave from work, week, 2 weeks, 3 weeks, a month, 2 months, whatever the thing is. So making sure that your work stuff is transitioned to someone, your out of office is in place, so you're not worrying about work at all. You're focused on healing and getting better. Okay, number 5, the last one, maybe the most important because it's kind of the stopgap, is your support staff, family, friends, even hired folks to help you get from surgery day to post-surgery, your new you. So the number one thing you need from the support person is a ride to and from surgery. Usually you could drive yourself, but you will not be able to drive yourself home, and they won't let you use most places won't let you use like a hired place, like an Uber or a taxi or a Lyft or anything like that. You have to have a dedicated person that's going to drive you home. You nearly always need someone with you for the first 24 hours, and sometimes 48. That's kind of a case by case. It might be even longer, but the minimum is 24, I would say. And it's 2 reasons. You're going to need help with basic functions, whatever restrictions you just encountered, you need some help. And then they tell you, because the anesthesia is still in your body, that they don't want you making any decisions, and you might not make the best decisions even for yourself, like getting around or doing things. So someone there to kind of protect you from yourself, thumbs up. What else? Help eating. You might need somebody to go to the grocery store, even though you prepared and stocked your fridge. You might find you need something additional. Making or bringing in food for you to eat and making sure that you stay hydrated and fed, another task for your support staff. You might find that you need to run to the pharmacy despite preparing in advance. New medication might come up, or they scripted, this is what happened to me, they scripted you the wrong medication in advance, and now you got to pick up a new one. So you might need some help there. Post-op follow-ups with your doctor. Is this the last one? Oh, sorry, I missed one. Settling into your nest. So wherever you're going to rest and sleep, you might need some help getting in there. Even though you prepared in advance and got everything padded and so forth and so on, in and out might be difficult for you, especially in the beginning. So having support folks, thumbs up. Okay, and the final one of the whole video, thanks for sticking with me if you did, is post-op follow-ups with your doctor, which kind of is an afterthought, but you need to go. For surgeons, they need to look at the incisions, make sure nothing looks wonky. They do this all the time. They know what looks right and looks wrong. You may still not be able to drive at that point, so you might need a ride there, so having that support person. But beyond that, extra ears at the doctor's office is always a good thing, because sometimes you get focused in on one thing or you're overwhelmed and you don't hear everything they're saying, and having somebody else hear and interpret the data is always helpful. If somebody can't be with you, I would recommend calling them on the phone and letting them listen in, or asking the doctor to record it so that you can listen back. So those are some suggestions. Finally, and probably more applicable to me, the perpetual cancer patient, unfortunately, is post-surgery, you're going to get pathology news most of the time, depending on the doctor you're seeing. So I personally have 2 post-op appointments this coming week. One is with the plastic surgeon, and that will be more about how it looks and checking on the incisions and all that stuff. Hopefully taking out these surgical drains. But my second one is with my breast surgeon, and she's really the she's cancer focused. And I believe that when I see her, I will get pathology, my post-op pathology. So all the material that they take out of you during the surgery, especially for a cancer patient, goes down to pathology and gets evaluated. And for me, as we've talked about in some other videos, that's going to determine my treatment course for the next probably year. Excuse me. If the chemo we've just finished worked, then I'm just doing antibodies for the next year. If it didn't work, or they're still seeing something concerning in the pathology, then we have to make a new plan with my oncologist. But either way, when you get that kind of news, it's good to have somebody to hold a hand or to support you, or a hug, or whatever you need, right? So I would recommend on your post-op appointments to take a support person. And I guess as an example here, it's kind of a side example. About 20 years ago, I had what they believed to be a non-malignant cyst in my ovary, and it was removed. And I went to see my OBGYN as a follow-up to that, that removal. Check the incision and give me the clear go ahead to move on and do, my kids were young and all those things. And they're like, did anyone call you? And basically the pathology from that surgery showed that I had ovarian cancer, and I didn't have anybody with me in the room. So I was totally shell-shocked and kind of beside myself. And I had to get home to my husband and my support folks to figure out what to do next and everything else. So definitely, even if you don't think your post-op appointment has any interesting news and you're worried about somebody seeing your body parts or whatever, they can avert their eyes if you don't want them to see. But just having that person with you, I totally recommend. So these are my 5 tasks or action items or I don't even know what to call them. I should come up with a name before I put this video out, huh? All right, I'll name it. And if you don't like the name, give me some suggestions down below in the comments. And certainly, if you guys have any suggestions for folks that are going through this, having a surgery, what they need to do to prepare, let's include this here. That's all I've got for you today. Thanks for staying to the end. Appreciate your support. If I'm being helpful, subscribe, like, share if there's anybody you know that would benefit. And what else can I tell you? I think that's it. Tomorrow's going to be a better day. Be well.